Hopefully everyone can see those slides. Thanks very much, Sonia, and thanks everyone for joining. It's a great group to have together, and Natalie and I will talk you through some of the work that we do at Zinc and also some of our reflections and learnings from the last few years and what we're kind of seeing in the landscape at the moment. Um, Maybe I'll just give a brief introduction to myself and give an overview of Zinc, and then I'll hand to Natalie, who's going to talk you through Zinc's investment side. And Natalie can introduce herself at that stage. So I have been in Zinc since the beginning, which was 2017. So I joined as chief scientist, and the role was to sort of provide hands-on support to our ventures around science and research, academic partnerships, and things like that. And then more recently, I've worked more on our innovation partnership side, which I'll tell you about shortly. Prior to Zinc, I was originally an academic. I did a postdoc in behavioral science at UCL, which was the reason I moved to London, and then spent a little bit of time in Bupa in the health team in a newly formed behavioral science group there before joining Zinc. So I've been in this kind of health innovation space now for a while, and seen some of the changes along the way. To give you just a very brief overview of Zinc, because we've kind of structured ourselves slightly differently in the last 6 months or so. We've been around, as I said, since 2017, and our broad goal is to unlock the potential of science for impact. And we work in two main domains, in health and in climate. So most of our work across Zinc sits in one of those or at the intersection of those domains. But our work is kind of broadly split out into two halves. So the first half is our investment side, and Natalie is going to talk you through that. We invest in very early stage startups through our investment fund, and we have a kind of venture building process that we go through as part of that. And then the other side, which is the bit that I'm in, is our innovation partnerships work. And that's where we design and deliver innovation programs with and for partners. So what we thought we'd do today is give you a bit of an overview of each of those kind of areas of work and share some of the reflections that we've had from having kind of been applying our methodologies in practice over the last few years, thinking about where the big bottlenecks are around science for impact, and what we could do to unlock some of those. So hopefully that helps, and we'll try and leave plenty of time if anyone has questions. And also feel free to jump in if anything needs clarification along the way. So I'm going to hand to Natalie, who's going to first talk you through the Zinc investment side.
Thanks, Rachel. Just as a way of background about myself, so I oversee all of the healthcare investments and portfolio at Zinc. I joined Zinc about 3.5 years ago, initially as MD to oversee deep tech and deep science investment. And I'm now a partner of health and life sciences, helping raise the next big fund. Before that, I worked with an Italian venture builder and fund, spinning out technologies from Italian universities and building those into ventures. And before that, I was on the operational side of startups, so very much working with early stage ventures myself, raising funding, building products, building teams. And then initially, I was, like Rachel, also trained as an academic in life sciences with a focus in ophthalmology. Maybe next slide, Rachel. We believe that Zinc has really fundamentally transformed the UK pre-seed capital ecosystem with its first fund, which was approximately a £30 million fund. And here, for the last few years, we've been giving out first checks, really being the first money into early stage science for impact ventures, giving checks of around 150,000 to 300,000 pounds, and offering a ecosystem of support as well as hands-on support in building these ventures to take them to the next stage. And we're now doubling down and raising the next fund, which is going to be a £70 million fund to really be able to double our impact to support these science for impact entrepreneurs with greater capital, greater time frames, and much more hands-on venture building. And we are committed to the UK ecosystem. We're a UK-based fund and taking the entrepreneurial talent here from start to seed. So I'll talk a little bit about, how we've been doing that, the current fund, and what we're looking to do next and more of, as well as share some of our learnings, as Rachel mentioned. So we really believe, and we have seen this over the last number of years, that the UK has a large pool of untapped science for impact entrepreneurs. And, we call them science for impact entrepreneurs because they're looking to leverage technology. They really believe that science and deep tech can unlock some of the solutions to the world's biggest challenges. And they can have a variety of different backgrounds. So they can be scientific innovators outside of universities, they can be commercial leaders, they can be entrepreneurial clinicians, which we see a lot of coming out of the NHS, for example, specialized domain experts that are looking to disrupt their own industries, and really researchers that are hungry to have scientific impact beyond just being in academia. We know that these entrepreneurs have years of experience, so often 15 plus years. They are very sharp, they're commercially savvy, and they're quite diverse on a number of metrics. Next slide, please. However, we are seeing, and again, have experienced this for the last number of years, that the UK's support for venture building, really venture building from concept, from idea, is too often failing these entrepreneurs. We see a lot of wasted potential, particularly at the beginning. So ventures either not getting started at all because there's insufficient support, insufficient handholding, insufficient funding to get them going, or they get off to a pretty bad start in the beginning because they don't do things the kind of the right way. So things around protecting IP, for example, things around who you raise from, how you raise funds, how you build a commercial roadmap. And often they're then faced with this stop-start journey, trying to navigate an extremely fragmented, patchy ecosystem. And we know what this ecosystem looks like. There's a lot of kind of accelerator support, but it's not very hands-on. Oftentimes, there's often not a lot of funding associated with it. There's a lot of grants, but they're not always aligned with equity. So again, you have this very kind of patchy stop-start grant ecosystem. There's a lot of generalist funds, but absence of really specialist pre-seed funds. Insufficient kind of local ecosystems that enable to really properly tap into things like talent, into things like investment, into global commercial roadmaps, et cetera. And so you continuously have this sort of spliced up micro stages within the start to seed journey for these entrepreneurs. And that's what we have committed to being able to fix with the proposition that we've developed. So we partner with the world-class talent from the very beginning of their venture building journey and really getting them to the next meaningful inflection. And this is what we tend to call the start to seed journey. So these are just some examples of the founders that we work with. So scientists in and outside of academia, these are innovators on the front lines. They're developing and deploying the breakthrough technologies themselves. They've got firsthand insight into the critical market gaps for these technologies. An example of this is Dr. Natalie Hastings from Celestial Health, which is a Cambridge University spin out, and is developing a treatment for Parkinson's disease leveraging astrocytes network biology. We also work with commercial founders who are seeking to make greater impact in their space. These are typically seasoned and proven commercial operators and consultants. They'll leave their corporate careers for this kind of high-paced, high-impact startup journey. So an example of this is Alison, who came in as the CEO of Respiro Diagnostics. She left her pharma job to do this. And she's now innovating at the intersection of breath biology, biomarkers, and diagnostics for complex lung disease. And then another good example is lived experience founders who are really bringing together science and technology to solve problems that they have a first-hand experience of, and either kind of a personal relationship to disease or condition, or they just really understand that pain point maybe as a customer. An example of this is Nick, who is the CEO of Serenatus Bio, and he's developing new drugs to treat OCD, leveraging his own personal lived experience and a network built as a biotech entrepreneur. Um, Next slide, thank you. And so over the past 8 years or so that Zinc has been around, we've now worked with over 400 founders like this, and we've designed essentially a venture building product that these kinds of founders, these entrepreneurs need. So number one is that we're really there when they are generally too early for other investors. So a lot of investment has been moving downstream in the UK. So from pre-seed to seed or from seed to Series A, and funds are now kind of less inclined to invest at the really, really early pre-seed stage. We've committed ourselves to the pre-seed stage, and we are embracing the risk that comes with it. We know that there's deep technical risk. We know that there's going to be some commercial, there's going to be team risk, but we're backing potential, not just the track record of what they've built already from the very concept phase. So we can kind of, have a lens to the future. And we're trying to lean into the highest value problems here. Number two, we do really put a lot of emphasis and focus on talent. We know that talent is key to building the right kind of venture, the high impact, the high potential. So we know that also talent isn't perfect. We try to identify key areas of personal development or team development during our sourcing and scouting process, and think about how we can best support them post-investment, which is generally often missing from the ecosystem. We help build the right team for each venture. So where we know that there are gaps, we help proactively fill them, and we coach individuals and teams through their various transitions and growths that they go through. So we've got a network of executive coaches, for example, that work very directly hands-on with our founders and teams. Number three is we do identify and fill the gaps wherever they might be. So we already talked about building the right team, but also things like developing their commercial and product plans, creating and protecting and potentially sourcing IP when it's needed, and really anything that along the startup development journey those founders might need, we can help through our very bespoke and very hands-on venture partnering support. So all of our ventures get a venture partner, somebody who's experienced, who understands their space, who's done it already. So exited founders, for example, who work very closely with the new startups in our portfolio. And number four, we provide them capital to get them from that start to seed journey. So we are typically the first money in. We don't necessarily need to wait for other investors. In our next fund, we're looking to be able to provide flexible funding with hopefully up to £1 million, which is what we're seeing founders need to get them to a credible seed investor. And we're really working hard to be able to seamlessly combine and blend equity and grant funding, because we know we need to rely on grants, particularly for highly scientific ventures, deep tech, and we know that private equity can't just get them there, but we need to make sure that those two sources of capital are well aligned. So our health investment strategy is really focusing on emerging and converging technologies. We're very much focused on industrial strategy alignments, but also have robust diversification across our portfolio. We look at the innovation drivers, so things like the convergence of bio and tech, like AI and deep tech, areas and angles, personalized medicine, gene editing, biomarkers, looking at the rise of value-based care and chronic disease management. And we're closely following the capital trends. So where we can, we align to the industrial strategy, the growth in cost reduction and improving patient outcomes, and really for investors favoring more deep tech and deep science over the traditional software and consumer platforms. And so some of these opportunities include things like biotechnology and biomanufacturing, early intervention, non-pharma alternatives, AI-enabled healthcare delivery, life science tools and tech, and things like advancing health span. Within our current funds health portfolio, we've got approximately 30 health ventures now. And these range from medical device to engineering biology to clinical services. to therapeutics, and really quite a broad approach to our portfolio. So across medical devices, we might see things like female hormone measurement and birthing support devices, to better cancer detection, to improved robotic surgery. Within engineering biology, we have a range across things like exosome drug delivery and development, epigenomics, splicing isoforms, and so on, and much more. Within clinical services, we've got everything from self-harm therapy to asthma and chronic condition management to pediatrics primary care. And we've got quite a range of therapeutic centers now as well across OCD, oncology, cardiovascular, and beyond. We are consistently science and impact focused, as you might start to recognize now. So we are committed to this in both our current fund and the next fund. The average Zinc founder age is 38. So this is a little bit older than some of the kind of traditional startup funds where the founders might be very young, just out of university, for example. We've got profiles that are quite a range. As I mentioned, we source our founders from big corporates, from industry. They've got years and years of experience. Our own investment team has very strong track record in both entrepreneurship as well as in science and technology. So really heavily focused on PhDs and deep tech. And we've now seen over 7,000 impact-led entrepreneurs through our venture building funnel over the last few years. We ourselves have deployed about 10 million in grant funding partnerships. So we've worked with partners like UKRI to be able to support entrepreneurs on their commercialization journey. And we've got quite a range of diversity metrics. So over 50% of our founders are women, over 50% of them are non-white. While we are UK based, 50% approximately of our ventures are not within London. And we go even beyond the kind of traditional research triangle area. So we've got hubs in Scotland, for example. We've got investments in the Southwest and Northern Ireland, now in the Midlands, in the North, and continue to be diversified across the UK. And we believe that this is a great moment to be a pre-seed investor in the UK. It's a really exciting opportunity to seize the wave of entrepreneurial talent of the scientists, engineers, clinicians. There's a real urgency around the rising global pressures demanding faster science translation. There is a convergence of technology and opportunity for technology to really make an impact with new scientific discovery and new tools. We're seeing progress across synthetic biology, materials, quantum, data, and AI. So there's a lot of opportunity where the UK is a center of excellence for these technologies. And it is now a kind of, there's now an unprecedented public investment in the UK to be able to support these technologies and get them to a point of impact. So we're really trying to align with that strategy. And then just to kind of think about, what are the sort of reflections or the learnings from the investment side. So I talked about this briefly as I was going through the slides, but some of the learnings over the last few years are reflected in the way that we're setting up our new fund and why we're kind of doubling down on some things. We have seen that ventures and entrepreneurs need more money and more time now more than ever, given the current environment with where VC is and given the type of technology that we're looking to support. So that deep tech and deep science. We know that we need that kind of circa 1 million of pre-seed to be sufficient to get the ventures to the next stage. And that's why we're setting up our next fund and our next round of investments to be aligned to that. We have seen ourselves the failures of the traditional investment and traditional ecosystem support. So we have elected, for example, to not wait necessarily for other investors to put our money in. In some ways, it gives us an advantage because we can work with entrepreneurs faster and we can in many ways be more attractive for them because we can allow them to get going. So we don't necessarily need to kind of bring a full round together if we can meaningfully see that the entrepreneur can do something with our check. So we can what we call lead rounds of investment and don't necessarily need for others to follow us in those rounds. We also have learned that the majority of talent really resides outside of the academic spin-out ecosystem. Only about 10% of our portfolio is spin-outs. And so really being able to tap into those founders, those entrepreneurs that are outside of academia gives us, one great investment deal flow and great opportunity for really interesting science and tech innovation. But also, those are the entrepreneurs that need the support the most because, when you're in an academic ecosystem, you can rely to some extent on academic grants. But when you're outside of that ecosystem, you don't have that option. So this is where we've got the opportunity to make a greater impact. We are seeing excellent clusters outside of the London and Triangle area, as I mentioned, and have made quite a number of investments and will continue to do so. So we're very keen on supporting areas of the UK where there's great science and great technology, but maybe doesn't have the same kind of access to the VC ecosystem as London does. And then finally, this has been a kind of an ethos from the beginning, but also a learning along the way is that really many ventures do require active building from the first instance to be realized. There's a lot of our ventures that essentially just wouldn't exist if we hadn't stepped in to fix something. This might be something like team or IP or cap table or commercial strategy. And most investors would have just passed on these ventures and moved on. But at the early stages, these are real problems that often do need to be fixed, and that there is real potential in those founders and in those ventures. And us being a venture builder has both the opportunity but also the advantage of being able to do that. So I think I'll stop there and back over to Rachel.
Great. Thanks so much, Natalie. So I'm going to just do a brief overview of some of the partnerships-based work that we've done and how that works. And then I'm going to go into some of what we've seen and learned and where we think the kind of ecosystem is headed. So this is, we've been doing work under this banner for about 5 years, but without kind of bucketing it in this way in Innovation Partners. So more recently, we've kind of restructured things such that this is now in its own kind of pillar at Zinc. And our goal within that pillar is to turn science into real world impact. And how we're doing that on the innovation partner side is to design and deliver innovation programs that unlock the potential of science and research to improve the health of people and planet. So in practice, what that looks like is that we are working with funders, research institutions, governments, businesses, charities. And there's probably two kind of categories of work at the moment for us. The first is that we have a set of kind of programs that we've been doing for the last number of years that we feel are relatively well proven, which we're keen to do more of and grow. And the second bucket is where we've seen or a partner organization has seen a really clear bottleneck in the ecosystem that we are really keen to design and deliver new programs that can try to unlock those opportunities and tackle those bottlenecks. So that's more speculative, and I'll give some examples of both of those now. Across all of our work, there's a few sort of design principles that we employ, and this is mostly based on learning from previous work that we've done. So we try really hard to deliver value when we're recruiting for a particular program. we try really hard to deliver value through the recruitment process. So where we've done research commercialization programs with UKRI, for example, we've been really keen that there is a big sort of mindset and culture piece around that to try to get scientists who are based in academia to come forward for innovation and entrepreneurship programs. And we really want to try and get beyond the sort of usual suspects and into the folks who might have the motivation and the skills and the scientific kind of research, but who won't wave a flag and say that they want to do innovation or entrepreneurship or commercialization. So we've tried to work a bit more proactively to kind of open doors for those types of people who could benefit from support around commercialization, but won't necessarily come forward for it. And we try to deliver value to those folks through the recruitment process, so that even if they don't get the grant at the end, for example, they feel that they've gotten some value out of it, which is important for this sort of broader culture and mindset piece that we care about. Pretty much all of our programs are about multidisciplinarity and trying to bring people together who wouldn't ordinarily come together. And we think, as will be news to no one, that great innovation often sits at the intersection of disciplines that don't typically work together. Natalie talked about this already. We have a big focus on talent. We do try to support a really broad range of commercialization routes. So I think there can be a sort of default to a traditional spin out, kind of VC backable. One of the reasons for us carving out this second space in Zinc for innovation partnerships is that we don't want to be constrained by that sort of VC model. There are plenty of extremely valuable propositions that will never be attractive to a VC and will never go down that route, but who could generate a sustainable impact through another commercialization route. So more and more, we're looking at how we can support particularly kind of scientific entrepreneurs to think about the right commercialization route for them and their innovation. There's something really important about kind of trying to get escape velocity in the early stages, especially if this is a sort of an academic research project that's looking to in some way translate. There's just something about building momentum in the early stages, and then you can kind of start as you mean to go on. So we put a lot of emphasis on how you can get that initial momentum and escape velocity. We sort of refine our programs as we go. We try and share learning as we go, and we're really guided by what our kind of partner organizations want and need and prioritize. I'll just give you a couple of quick examples. So since 2020, we've delivered a program called Catalyst for UKRI. 4 years of this was on healthy aging. And then in the last year, we've also done one on food systems. And the broad kind of goal of this is to take a kind of early stage piece of research and help it to get to sustainable impact through some kind of commercialization route. So some of those will be spinouts, some licensing, some social enterprise, some partnerships. And we're kind of agnostic about the route that it takes. But the goal is to try to enable the innovation to survive past the end date of the grant. So in these cases, the funder will give a grant directly to the academic team, and then we provide a sort of wraparound program of support to help that team progress. And I'll talk you through some of how we do that. But we think that whether it's a kind of Zinc program or others who do this, we do think that kind of support is really critical, and often the funding isn't enough to get that sort of momentum that you need in the early stages. So we do this from a kind of bringing teams together, trying to create new ideas among new teams through sandpit type mechanisms, a kind of traditional venture building process. And then we've also delivered a number of follow-on accelerators as well for a subset of teams that are high potential. We deliver support across these 4 journeys, and I'm going into this not because it's sort of anything revolutionary, but just because it kind of reflects what we think is important and what these teams need. So the first is the personal journey they go on, their own motivations, ambitions, and how those align to the innovation. This also includes the team, getting a team to function cohesively. The second is the product, how you could de-risk whatever needs to be de-risked about the technology or the innovation. The third is the enterprise, which is what I've just talked about. What's the right commercialization route? And the fourth is the community journey, how you can get the right partners and supporters around you to make progress. we don't explicitly have a weighting system for these, but I think most of our team would agree that the first one tends to be disproportionately important. In the early stages, so much of this is about the people and helping them to kind of navigate their own journey through this. So we put a lot of emphasis on how we could help the individuals to get kind of clarity and support, whether that's through executive coaching, as Natalie said, or otherwise. The second example is our innovation fellowships. This is where we basically parachute a postdoctoral scientist or a clinician into a health venture to get kind of immersive experience. So they're 6 to 12 months, minimum of zero point 0.5 FTE. And researchers through these experiences get proper first-hand exposure to an early stage startup environment without needing to themselves have an idea that they want to commercialize. So it's another way for them to get, I guess, to make this whole world a bit less opaque and understand what it means and what it looks like to be part of it on the ground. So we have a cohort of researchers who do this the cohorts start every September, currently funded by Viventa, who's on the call knows closely, and the NIHR. And I think it's an amazing opportunity for the ventures who get this, highly talented, skilled person, and it's proven to be really beneficial for the fellows as well. And we have a lot of learning from this that we're always happy to share. You can also read some of that. We produce an impact report every year where we share some of that learning. Some just individual things that we've learned from the programs that we've done, Catalyst and Innovation Fellowships. I mentioned this, but I think the kind of personal development of the founder, we have found to typically be more important to focus on than supporting in the weeds of the technical development. Of course, the latter is important, but if the team falls apart or the person decides that they don't want to take it forward, then the technical progress will stall. So we've really tried to kind of emphasize the personal journey of the individual. We've completely shifted both our own venture builder, and almost all of the partnerships-based work we do to what we call a venture partner model. So this is where we basically put a member of our team or network into a venture for a good chunk of time, like a day a week, to provide really hands-on, tailored, bespoke support in order to help them progress. And we've gone from a much more sort of cohort-based approach. We still do cohort-based elements, but we've found more and more that kind of individual, hands-on, tailored approach is much more effective. People really like the in-person cohort days. They really appreciate the cohort element. They get a lot of peer-to-peer support, so that we think is really important. I'm not going to go into this because everyone on the call is very familiar with the challenges around getting scientists out of the sort of traditional research project mentality into one that's more about sort of de-risking, testing at pace, learning by doing. That's the majority of our work ends up being some version of that. And again, lots of learning there about what works. And then I mentioned this already about kind of starting to think more carefully about broader commercialization routes. On the innovation fellowship side, I think one of the things we found is that scientists will often come into that program really not knowing what their transferable skills are and not understanding how they could work in, start up, or collaborate with a venture. And it's just by being kind of on the ground that they start to really see the breadth and depth of their value. And likewise, I think ventures, even those ventures that have scientists in their core team, will often not exactly know what they need and what they're missing and what they value until they've had that exposure. So we've ended up with quite a few of our innovation fellows who've been offered jobs out the other side or had continued in some sort of consultancy or collaboration arrangement. But I think it's kind of taken the learning by doing to get there. And I don't know that if you kind of pitched it in the abstract, it would have had the same value or appeal. We are then designing and delivering a bunch of new programs and new initiatives with partners. So a couple of examples of that might be relevant. We are in the process of designing a national pain institute with a group of collaborating academics led by Professor Chris Eccleston. to try to coordinate the UK's research, innovation, and clinical practice in pain. We are soon to start up a new deep tech fast grants program, trying to support super early stage ideas that are way off a stage of being kind of tangible, to just give some of those scientists the headspace to think them through in a bit more detail. And we have funding for a first kind of pilot of that will be kicking off later this year. And then, most relevantly, we've been working closely with Sonia and Jane at TAR to think about how health charities are navigating commercial innovation and investment decisions. Some of you were at a workshop that we had recently, and I know that many of you have had conversations directly with Sonia and Jane about this. To think about how charities are navigating these different decisions and what we could do to support that ecosystem to come together. So we've written up some of the findings. I can share the link if that's helpful, but here's a summary. There's a huge bit around strategic clarity, kind of understanding what you're optimizing for before evaluating an individual opportunity. And a lot of these are kind of new questions that are coming up for the first time in this way at this scale. The second is about the kind of types of models and understanding of what the options actually are and which option is best for which purpose. That's not always clear. The third is something specifically around due diligence. This has come up a lot. That processes around DD are kind of inconsistent, conducted in isolation, even though there's DD about the same opportunity being done by, 3 or 4 different parties at the same time. There's no kind of coordinating mechanism. And then finally, of course, something about governance and capability and making sure that that this is done without destabilizing core operations. None of that will be new, I'm sure, to anyone on this call, but it's just trying to tie together some of the conversations that TAR and we have been having over the last few months. And if that's a space that's of interest, trying to think about how we can better support charities through this, through some kind of framework or tool, we'd be really keen to chat more about that. Last bit for me. So as Natalie said, we have seen in the last 8 years or so, just so many promising ideas that for various reasons are stalling. And to us, there seems like there are blockers at almost every stage of the journey. And that's not to say that everything is rubbish, because of course it isn't. And there's lots of great initiatives out there and there is progress being made. But this is still a really difficult journey for any individual innovator to take. Some of the things that we think someone should do something about to tackle. One is, we think we need to get better at demand signaling, having the starting point be a need from a partner or an industry player or a provider or a user that can then effectively get translated into the hands of a problem solver. So connecting problem owners with problem solvers in a more efficient way, and doing this kind of demand signaling in a better way in order to make sure that the priorities of the researchers and the entrepreneurs are actually mapping on to the needs of the market or the providers or the payers, without doing that after the fact in this traditional kind of linear way. We have some ideas about new approaches that you could take to IP commercialization, mainly to try to leverage the massive backlog of IP that's sitting on shelves and underutilized. Natalie's already talked about the need for more timely and coordinated allocation of capital. Natalie's also talked about the need to support innovators outside of universities. We've seen that a lot on the innovation partnership side as well. And then we've been looking a bit at sort of innovative procurement mechanisms, especially in health, but also in climate. This is both the cause of and solution to most of the issues that we've seen at the later stages of kind of innovation adoption. So I think we wanted to just end by saying, from what we've seen, it's clear that no single organization or funding source can carry innovations through the whole journey. So that we have to find a better way to coordinate across different types of capital and different sectors. And I think that there's a huge role that charities do and can play in this ecosystem. And we're really keen to work with individual charities to figure out what that looks like and how we might work better together. I had a quote from the recent review from Tony Hickson, which is about kind of university business relationships. And it's just making this point that we need to get more coordinated to have a sort of whole systems approach where we've got clear and shared vision and capital and consistency, so that we can support these innovations at every stage of the journey. So hopefully that was a helpful overview. As I said, we're always really happy to hear from people, to chat more, download our learning, explore collaboration opportunities. Our emails are on screen. So thank you very much.